Food. It nourishes us, comforts us. It's a cultural expression and a means to show we care. Food is the sustenance of life, but it can be dangerous and in some instances life-threatening. This presentation addresses how in-class course corrections can be applied to food service training when issues arise with course content and/or learner performance. Food plays a significant role in the patient experience at my healthcare organization, where thousands of meals are prepared for patients, visitors, and staff at one of our 5 hospital campuses and 36 outpatient clinics. To ensure the meals we provide are safe, food service personnel must be able to decipher which food items may trigger an allergic reaction, how to handle and prepare food safely, and how to react when an emergency such as a power outage or a fire danger occurs. The food allergy training that I designed is part of the food service orientation, which also includes 2 additional existing asynchronistic courses regarding safe food handling and disaster meal preparation. New employees are required to complete a general new employee orientation in addition to an orientation for their unit and job roles. This orientation is targeted specifically to adult learners who are food service personnel, which includes registered dietitians, cooks, diet clerks, and food service partners encompassing cashiers, dishroom staff, and tray line staff in a hospital and clinical setting. The online module portion of the food service orientation contains learning objectives, a presentation regarding relevant content interspersed with multiple choice knowledge checks, an online learning game, and a summative exam which is comprised of multiple choice, matching, ordering, and true-false questions. The food allergy and safe food handling courses are hybrid lessons and include in-person learning activities or skills demonstrations, which are facilitated by site managers. The skills demonstrations contain activities where, under the guidance and supervision of their managers, food service workers are asked to prepare food labels and assemble food trays at their site's kitchen facilities. Staff performance is reviewed on a quarterly basis, with formal employee evaluations conducted annually. The educational process at my healthcare organization varies to academic learning in that learning is presented in a much more condensed timeline of 4 to 6 weeks as opposed to a semester or calendar year. In the food and nutrition department, the average hire rate of food service personnel ranges from 50 to 20 staff members a month. During the most recent quarterly reviews, new hire performance issues have been reported by 2 managers for 2 employees at separate sites. In support of performance reviews, training statistics for food service personnel have been generated by our LMS. 17 food service personnel were hired last month. Here is a summary of food service orientation course completion. Upon review of the data, 2 workers were identified as not completing the training. Paul is a recent hire as a cook at one of our busiest hospital kitchens. He has 20-plus years of experience in the food industry prior to his new position at the hospital. English is Paul's second language, and he mentioned to his manager that he isn't too comfortable with technology. Eager to onboard Paul to the kitchen, his manager verified and signed off Paul's successful completion of the required skills demonstrations. His manager also reported Paul's proficiency in preparing prescribed diet meals, navigating in a busy kitchen, and adhering to procedures in preparing and labeling food. According to Paul's manager, Paul is an asset to the production line. However, HR contacted Paul's manager that Paul hadn't completed or partially completed the 3 online orientation modules. The LMS team worked with Paul's manager to take a closer look at Paul's training history. It was discovered Paul had completed all his online training but had not received a passing score for the 3 exams. A review of his participation in the modules revealed that Paul spent more than an hour for each module, which on average takes staff 15 to 20 minutes to complete. Mary worked in another healthcare organization as a food service partner, as a cashier and a dishroom attendant prior to joining one of our clinics. As part of her responsibilities, Mary assembles food trays for patients. According to her team lead, although they often don't work the same shift, Mary is friendly and helpful. However, Mary's manager recently wrote Mary a citation for several mistakes in tray assembly that was caught by one of the diet clerks Mary works with. As part of assessing learning performance, HR contacted the LMS team to review Mary's training history, which may provide insights to the performance issues her manager cited. 4 weeks into her employment at the clinic, Mary completed her online training. However, per LMS findings, Mary spent an average of 2 seconds per slide and in some instances skipped entire sections. Most of her online modules were completed in 5 minutes, which is well below the average learner spent with the material. A review of her learning activities revealed that she hadn't yet been signed off by her manager as completing these requirements. Chickering and Gamson's 7 Principles of Learning is useful for in-class course corrections as it supports learner performance and improves course effectiveness. Employing the 7 principles, the LMS team provided guidance to Paul's and Mary's managers on what we can do to help their staff achieve better performance results, as well as utilize these strategies to improve the course modules. In order to support online learning, Chickering and Gamson encourage contact between faculty and students. At my healthcare organization, the role of instructor falls to the manager. Manager interaction and engagement with personnel is key for staff success. After speaking with Paul, it appears contact with his manager is consistent. Paul mentioned both his manager and his team lead not only thoroughly onboarded him to the hospital kitchen, but continue to work with him. When asked about his experience with the online training, however, Paul expressed he had difficulty with the modules, particularly the narration, as he's more comfortable reading than listening to English. Scripts for each of the online modules had been drafted when they were created, but haven't been accessible to learners. To help aid learners, the LMS team will post the transcript PDFs as a resource in the LMS that learners can easily access. In addition, the LMS team recommended Paul's manager or Paul's team lead sit with Paul as he completed his online modules. Paul's manager agreed to arrange this as soon as possible. Paul's manager acknowledges that her interaction with Paul and all of her staff could be increased, particularly when it came to training. Upon interviewing Mary, she mentioned her challenges with tray assembly, something she didn't have very much experience with in her past position. When asked about her incomplete skills demonstrations, she stated when her manager left, her new manager hadn't set aside the time to sign her off. HR, working with the LMS team, discovered that Mary's arrival coincided with a management shift and her skills demonstration was lost in the shuffle. As the skills demonstrations provided instruction on tray assembly, Mary's new manager agreed to work with Mary to ensure she received that portion of the training. Online training isn't inherently supportive of social interactivity, yet a sense of community has been found to aid student learning. Although being a new team member can have its challenges, Paul's manager commented that Paul seems to work well with his team. The LMS team encouraged his manager to have her and other members of Paul's team to continue to aid Paul and each other with their job performance. With a managerial change occurring as Mary joined the clinic kitchen staff, she commented that she hasn't yet established rapport with her team and is hesitant to ask for help or clarification. Now that her new manager has been made aware of some of the challenges Mary experienced with her training being somewhat derailed, he's on board with the LMS team's recommendation that more seasoned kitchen staff assist in Mary's acclimation to the kitchen, assuring her that asking questions is encouraged. He also agreed to receive coaching on meeting the training expectations for his new role as a manager. Lastly, a new team lead will be appointed to that shift to support Mary and her fellow crew members. Chickering and Gamson emphasize active learning as a component to effective teaching. Learning activities were included in food service courses to promote learner engagement. According to Paul's manager, Paul completed the learning activities exceptionally well. To further foster active learning, the LMS team recommended that for future new hires and for current staff, Paul's manager utilize Paul's expertise in training others. Inviting Paul to be part of teaching the material to his fellow teammates further cultivates active learning. Since Mary hasn't had the benefit of participating in the skills demonstrations, completing those requirements would be a start in helping her engage with the content. With her previous experience, she understands safe food handling, but she admitted that identifying food allergens is something she could improve upon. Her manager's training intervention should allow Mary to catch up and get back on track. Research suggests that learners prefer prompt feedback as they complete a course. Both Paul's and Mary's managers, along with HR, alerted them of training and performance issues early in their probation period. The in-course corrections that have been activated should aid them in meeting job performance expectations. Chickering and Gamson highlight time on task as a principle of successful learning. Paul spent quite a bit of time on his online training, yet didn't pass the required exams. Supplying Paul a transcript of the training is one step in helping him understand the material. Another step would be to have the transcript translated into Spanish, his primary language. A plan to have our food service training transcripts be professionally translated to Spanish, Vietnamese, and Tagalog has been submitted to leadership for approval. According to LMS reporting, Mary didn't seem to spend the time it would take to read and listen to course content. The LMS recommended that Mary's manager sit with her as she reviews the online modules and answer any questions Mary may have. Communicating high expectations is key in learner performance. One of those high expectations include interfacing with technology. A primary factor in achieving success and satisfaction in learning is comfortability with technology. Paul expressed some resistance to technology. With coaching from the LMS team, his manager clarified with Paul that using technology such as the LMS, the food labeler, and food tray ticket software are tools that Paul will be expected to use with high proficiency. Paul agreed and commented that he is growing in confidence using these items. Mary's manager emphasized that completing her LMS training meant interacting with the online modules and not merely clicking through each slide. By reading and listening to future online material, Mary's exam scores should move from passing to excelling. Chickering and Gamson cite respecting diverse talents as a way to encourage learning. Paul and Mary bring years of experience to their teams and their respective kitchens. Using LMS reporting, observations from their managers, and interviews from Paul and Mary themselves, their diverse talents and learning needs were identified and incorporated in their in-course corrections. Employing Chickering and Gamson's 7 principles of learning not only provided guidance in supporting learner performance, it was influential in making in-course corrections to the online course material. These in-course corrections help make learning flexible, responsive, and increasingly effective.